On this week's Vero Beach Social Media Pop-Up Podcast, we talk to Angela and Wendy from the Mental Health Association. We talk about all the programs that they offer and how they're getting the word out to all the people that need their services. Give it a listen. You're going to love it. I guarantee it. Here we go. All right, everybody. Welcome to another episode of the Vero Beach Social Media Pop-Up Podcast. We are here at the Mental Health Association with Angela and Wendy. How are you guys today?
Great. Thanks for having us.
You're welcome. And this is a little odd because normally we do these at another facility. We'll do it at another business, another restaurant or something like that. But today we are actually here at the Mental Health Association facility, which is gorgeous, by the way. Really nice place. So I want to hear a little background. I want to hear everything about the MHA, but I want to get a little bit of background from both of you guys about how you got into this, and then maybe a little bit about how the Mental Health Association started. So if you want to start, Angela.
So I've been the chief operating officer here for about 6 years. I came from a community mental health center working basically in the trenches, doing a lot of intensive services in jail mental health. So I have over 25 years of mental health experience. With that and seeing the needs in the community, I have now targeted more of doing administrative stuff and getting money to help those people. So my experience here has been absolutely wonderful because of the way our mission and vision is. And I truly believe in it. And I truly believe that we make a difference in lives.
Great. Yeah. And Wendy, I know that you're relatively new to the Mental Health Association, but let's hear a little background, how you got into this and what you do for the MHA.
Well, I'm more of a content creator and a writer and a storyteller naturally. And I have this passion for psychology and mental health advocacy. When I'm not at the MHA, I am helping out individuals who leave high control groups. And one of the quotes I live by that I say on all of my episodes when I sign off YouTube is, in each other, we find ourselves. And when it comes to storytelling, I think it just goes hand in hand with mental health. So I applied for content creation, and I've just been so blessed, richly blessed with the creative freedom to work with mental health and storytelling. So I do their social media, I'm working their website, and so far it's been wonderful.
Seems like a perfect mix.
I think so.
Yeah. Awesome. It has been.
Well, let's talk about the beginning of the Mental Health Association. You guys have been around 60 some odd years.
Yes.
Talk about that.
Over 60 years. Mental Health Association Indian River County was founded in 1958. We incorporated in 1978. Dr. Helga Olseth, who had a long career in nursing, had decided to come, and she was one of the first principals in Fort Pierce at one of the high schools, a female principal, and becoming a doctor. And then she decided she wanted to teach nurses about mental health and mental awareness because they were getting a lot of people with mental health issues in the hospitals and stuff. So thus, she started Mental Health Association, which was a peer advocacy group, and we still are. We wear many hats, which we'll get into. And then we incorporated in 1978 as a 501c3. And throughout the years, we have worked primarily in peer advocacy. We're an affiliate of Mental Health America, which is a wonderful affiliate, and you have to have your certification for that. But we have partners all along the whole United States that work advocacy services for mental health, including lobbying and different things like that. So, we would have our substance abuse license, but in 2006, we started a Turtle Tracks campaign, which...
We've got a turtle. I imagine that has something to do with something.
This is one of our sponsor turtles. She's been here since the inception, and we have all the sponsorships. So Turtle Tracks started in 2006, and it was a fundraising event to open our walk-in and counseling center, which opened in 2007, and also with some donors, because we wanted people to come in and get immediate help instead of going to the emergency rooms being able to deter them and be able to see them for free and get some of the help that they needed. And I can kind of go more into what we do here at the Walk-In Center. And we have many other branches that we work on.
So I was an x-ray tech for, 12, 14 years before I got into marketing. And I worked at the hospital for a while. And I remember one common complaint from most of the staff was people would come in with an ant bite or a bee sting or a minor cut to the emergency room. And it was like, man, I wish we had more walk-in clinics. I wish we had easier access to just going to, a small clinic and being treated. And then the hospital there started this kind of minor care and little walk-in area of the emergency room, but it was still incredibly expensive to go to the emergency room, to be seen in the minor care and to be treated. So you guys are basically the walk-in clinic for mental health as opposed to, the bee sting or the minor cut or the abrasion. And you guys are free. Is that what I'm hearing?
Absolutely free. That's why we work so hard at writing grants and having donors and getting appropriations funding through lobbying. We want to make sure that people have no barriers to getting what they need to get. And, you have it exactly right. A lot of people call us and they go, I could just walk in. We're like, yeah, walk in. No appointment necessary. It's free. We do accept donations, of course. But,
well, you have to.
But, we just want no barriers. And going back to what you said with the medical field, mental health with Mental Health America did a before stage 4 campaign. So think of cancer, you want to get it before stage 4. With mental health, you want to get it before, it gets progressively bad. Here we do a therapy first model. And what that means is, okay, you have anxiety. You can go to the emergency room. They can give you some medication. That is not going to solve some of the issues that you need to be working on and some tools that you need in order to get through whether it's an episode or, something happened. So we believe in the therapy first model. We do have psychiatry services as well, because some people do need medication to either stabilize mood or depression. But, about 80% of people with anxiety or a minor depression can get help through a therapy first model rather than turning to medication or drugs and alcohol.
So you mentioned you have psychiatry services, and that reminded me you have UF right across the parking lot from you, and then you have the Behavioral Health Center. Do you guys collaborate? Are you competitors? How does that, again, I'm very ignorant to all of this. How, and again, if I'm out of line, just say I'm out of line.
But, that's perfect.
But how do you guys all work together, or do you?
We do work together. So the Walk-In and Counseling Center was designed just to screen them and send them to providers and work with community providers. As people got more comfortable, I was comfortable there. You guys did good. We've expanded on our counseling services and then added adjunct psychiatry. Now, we used to have the psychiatrist from UF and have a contract that way, but it just kind of grew and there's enough to go around. So we do see some people who go to psychiatry at University of Florida or Treasure Coast Community Health.
That's one I forgot to mention.
Yeah. Or Whole Family Health. Right now, Whole Family is short on clinicians, and they're seeing them for psychiatry and need us to provide the therapy. So we really try to work in kind of a non-siloed community. We are on the collaborative. The Indian River has a very strong mental health collaborative, and the collaborative gets all the agency providers together. We have plenty of clients to go around, and we want to do what we do best. And if somebody comes in for a screening that needs more intensive care, we refer them out if we can help provide the care. So we are there, and we're different because somebody can come in and get immediate screening. I don't care if you come in once a week because you're in crisis. They may have a therapist outside in the community that they can't get with that day. We just want to help that person no matter who their provider is. And a lot of the times we absorb that because it may take 2 or 3 months to get into a community provider. So we work very closely in this community. As far as Behavioral Health Center, they're the inpatient unit. Just recently, with the help of Hospital Taxing District and a visioning committee, we opened an intensive outpatient for teens because there was a need in the community, and we are very enriched to have a hospital taxing district that wants a healthy community, both physically and emotionally.
Is that intensive outpatient for the teenagers here, or is that over there?
For any teenagers that are kind of like a revolving door, kind of going inpatient, and intensive outpatient programs are less restrictive than going into the hospital and trying to stabilize and then going back in the community. So they work with the families. So we do refer people that we are seeing at our outpatient here, or when they're done with the IOP, come back to us or get referred through us or other community providers. We don't provide in-home therapy. So another provider that, if it works for the family to have somebody come in home, that's what we're going to do. We're going to link them to that resource.
Gotcha.
So, every case is so different. We have so many different stories, so many great success stories. And like I said, being able to be there, we never know how many screenings come in a day. We were just talking about that the other day. We had one Monday, we had 13 people walk in. So it was all hands on deck. And we haven't broken that since, but on average, we have about six walk-ins a day.
So you mentioned before about whole family having a staffing issue, and that seems to be common in so many industries and so many fields. Do you guys have a staffing industry? What if 30 people walked in the door right now? What's the plan? What happens? Do you have the staff to handle
I actually like to say that I do. I mean, you never know, but yes, we would definitely be able to do that. I could go in a very long conversation about our model, but you are absolutely right. There is a disparity out there on licensed workers, social workers, and mental health counselors. I think when COVID came around, it really pushed a lot of them into doing telehealth, and they get paid more and doing private and not taking insurance. So we are a teaching facility. So we always had 2 masters, and we've had some doctoral students also come through here. So we always have master's students that are getting their master's degree in either social work or mental health counseling or family and marriage therapy. And then when they graduate, they become registered mental health interns. So they have to get enough hours to get their state licensure. So we have increased our administrative piece. Our CEO is a psychologist. We have a clinical director. And then we also have a licensed social worker who is our chief clinical officer. So they're able to provide the supervision. We provide our staff with a lot of trainings. And I find funding. So if somebody comes in with insurance, I do not have to worry as long as they're under 300% or below the poverty level, which is over $40,000 for a single person. I don't have to worry about, only this person takes Blue Cross Blue Shield.
Right.
I will take you under my funding free of charge, no copayment. Like I said, we don't want any barriers, because even as a parent, I can go in and a specialist costs me $80. Well, I don't think I can have you see my kid every week. I can't afford that. We know.
Yeah, it's a car payment.
Well, and we know what the economy is. People can't even find housing.
Right.
So, we have broken those barriers, and we work really hard. So we're able to kind of have those interns and train them and have ample supervision so we can service them, because I could have an Indeed ad out there for a licensed clinician and there is no biting at all. Most of our funding, our revenue comes in and it goes out just as fast, and it's mostly in salaries and benefits. We really want to treat our staff good, make sure we pay most of their health insurance, free dental, and try to get them to have the elite care, to give them enough time in a day, because it's very taxing on them having, 6 appointments.
Yeah.
And going through it with people. So we want to make sure that they're taking care of themselves too, because they have to take care of others. So we can kind of get away from that, where other providers have to have a licensed person, and then you have to go on insurance panels. A lot of red tape.
Sure. So this is all great. I mean, I think this is phenomenal. The services that you provide are amazing. And Wendy, I'm going to kind of turn this on you and put the spotlight on you now. And it seems like the Mental Health Association agrees with me here. How the hell are you letting people know about this?
Oh, yeah.
And again, I know you're new.
Yeah.
I'm not trying to put you on the spot.
No, it's fine. It's
rebranding.
fine. I do good on the spot.
All right.
So right before I came here, there was this phenomenal branding officer who she really took it in a direction that was just, I mean, I have a whole folder and her name was Shayna and I call it Shayna's Legacy. And she was just really good at what she did. So they took all the new branding, new logo, new everything. And then I come in and I carry the torch to social media, public outreach. We have a director who's in charge of fundraising, and that is her sole job, is to focus on fundraising and having events and thanking our sponsors. So we also just had a recent marketing meeting that radio is great, but it also costs. So we're looking for where we can keep our costs down. And so we kind of are getting away from radio. And that's why I called you immediately because you're a local podcaster and we want to keep it within our community. We wanted to keep it in our county as much as possible, because that is what a lot of our sponsors are passionate about, our community.
Well, I always joke around. You'll get about 7 people that know about your services thanks to this podcast, but there's going to have to be more that you guys are going to have to do.
Right.
And I was just curious if you guys, what kind of advertising? It sounds like you've been doing radio, and that's great. I mean, I don't have beef with radio or any other, marketing methods that you're going to take. But I'm just curious. I
just started TikTok because TikTok, Instagram, and Facebook are all different forms of content.
Very.
TikTok is more for a certain age group and for people who have a 3-minute attention span and they want to keep scrolling. So I'm working on that. Also, since we're really trying to focus on our youth and our community, we know a lot of people in our schools, because we have programs in the schools as well with our providers. We know if they're scrolling TikTok and there's something that can help them in Vero Beach, we want to give them that opportunity to find it.
Sure.
Same with Instagram, with the millennials, storytelling, blogging. That's what I'm using Instagram for, to tell success stories. Instagram is more of the, hey, they get me. This person sees me, the Me Too moment that people are looking for.
Sure.
And I was talking with Angela recently about ways to reach our adolescents. Florida law is 13 and above. They can come and get help. Correct me if I'm wrong.
Yes. Florida Administrative Code allows an adolescent 13 and up to have 2 sessions with somebody without parent consent. So you have a lot of teenagers. Okay, I'm 17. I don't want my mom to know,
Sure.
bad breakup, So they can come in and we don't have to get parent consent. So that's very helpful. We want to relay that. We are going to a youth summit and we are in the schools, which we can talk about, but finish.
And we'll also, we want to focus more on the positive aspect, not necessarily the, are you feeling depressed? We don't want to sound like a medication ad that you get on daytime TV.
Right.
So when we focus on the positive aspect of 3 tips for anxiety to make you feel better now, this is how we're getting the word out.
That's a great TikTok lead-in, by the way.
Yes, I know.
The 3 this or 5 that or 6 of this.
You have to see your Instagram today. It's really cool.
Thank you.
It is.
I'm in stories looking at analytics. More people are tapping through stories than they are posts.
Right.
So that's where we're really hanging out right now.
So culturally, I would say in the last year, I've noticed that and I don't even know what they call it, but mental health has been out in the news, and it's been, hey, it's okay. It's okay to talk about it. How has that affected you guys as far as, listen, the reality is I come from a generation, I'm 37, so I come from a generation where when I was a kid, it wasn't okay.
Right.
You didn't talk about it. You hid behind it. Now that's starting to come out where more and more people, especially the youth, are learning it's okay to talk about it. You don't have to hide when you come here. How has that affected you guys as far as getting more people here?
So we did not close throughout COVID. we wanted to be here for people, whether they wanted to walk in, whether they wanted to call, because we knew people were going through a lot of different things, including loss. We knew it was really hard on the kids having to do virtual schooling, because a lot of kids really, that is their getaway, school and socializing. So we did see an increase of people coming in for screenings. We did get to ask for additional funding. And you're absolutely right. It's okay to get help, reduce stigma in the community. A lot of people don't like that word stigma, but that's exactly what it is. No, not me. And, the breaking through the cultural barriers.
Yeah, even changing the wording, like instead of saying I am depressed or I am sad, it's I feel anxious. Like we don't want to identify with the mental health aspect, and even something as simple as that is changing lives. It's just changing their wording.
It's a characteristic of you.
Right. So sometimes it's just educational tools.
And I think people are just more open to talk about it, especially through COVID and having loss and change and just getting it out there, which is something that we're really targeting, and it's helping us. And I hate to say that a pandemic helps, but it really has helped us get that word out and make it okay to get help.
It made people aware, I think.
I remember The Sopranos, if you guys ever saw that.
I love The Sopranos.
I'm from Jersey.
Yeah, so Tony Soprano goes and sees a therapist. Like, that's a big storyline in the thing. And it was like, that's a big no-no. But I feel like in 2022, if Tony Soprano goes to see a therapist, like, they don't even write that in the script. It's not a big deal.
Right.
Yeah.
Which is great.
Right. Well, the theory is, listen, we go to eye doctors for our eyes, foot doctor for our feet, and psychology and seeing a therapist is basically just for our emotions.
Right.
You just need someone to kind of help you figure it out.
That's why I come to work every day and surround myself, so I get free therapy.
I know.
So is there a demographic that you notice needs your services more than another? I know we talked about TikTok.
Right.
I don't know if it's older men, if it's younger women. Is there a group that you want to reach?
So there's many groups that we want to reach. I mean, every group, we do demographic analysis and take a look and go, okay, where can we go and who can we target? So thus we are doing other programs to reduce the barriers and get education out there. For instance, 2 years ago, we started doing an Erica's Lighthouse model in the school system with the support of Hospital Taxing District, Children's Service Advisory Council, and Indian River Community Foundation. There's 3 pieces of that.
Wow.
Well,
nailed
here's the thing, when you have FundSource and you start programs, you have to have sustainability. So you want having 3 participants that are helping with it. And if one backs out, you're still good at continuing to have the programming. So you want to look at that. You just don't want to go, I want this program this year, and then not be able to continue it. So we work along with Substance Awareness Center, again, collaborating with another provider because they were already in the middle schools providing other programming. So they do what we call the didactic portion, which is the training portion, and we're there to be clinical. So what happens is we're in the middle and high schools, all Indian River County schools. We do that charter high school as well, but we're teaching kids about anxiety and depression, how to look for it, what they can do if they feel that way, how they can identify it in their friends, almost like a mental health first aid, and make them understand that it's okay. As well as when we're in there, we ask them if they'd like to talk to somebody, either within 24 hours or within a week. And we provide clinicians in the schools that directly meet with those kids based on their referral cards. So my chief clinical officer was going to be in here today, but there were 26 referrals at one of the middle schools that they're out seeing kids. A lot of the situations are very different in those cases. A lot of them, sometimes it's, the basic needs of the kids.
But this is the problem marketing wise, is that
Yeah.
we have services that literally are for every age group.
Yeah.
So
Right.
you don't want to throw something against the wall and say everybody and then
Right.
see what sticks.
Well, again, so we're a social media marketing company. Our niche is really targeting and finding those right people for our clients.
Right.
And yeah, we tell clients all the time, you don't want to hit everybody, but it seems like you need to
we need to.
hit everybody. So
Right.
what we do is we take very specific messages for those very specific groups, and then we segment out our messaging. And then, again, we'll use TikTok for the younger age
Right.
group, or Facebook for the older age group, or Instagram for the soccer moms.
Even our
and-
veterans, we have she wanted to get, it's everybody, every single age group. And so imagine every single day we come in and, and in our facility alone as employees, we all different age groups. We have younger 20s all the way up to, late 60s as far as clinicians and staff goes.
Right.
So we're surrounded by the needs of the different generations, and everybody needs help. But if we continually think, hey, everybody needs it, nobody's going to hear it.
Right. If it's everybody's job, it's nobody's
job.
Right.
Right.
So I want to back up a little bit, and I don't want to change gears, but I know that you guys have a big fundraiser coming up. So I want to talk about that, and then I want to talk about some more on the funding side of the Mental Health Association. So tell me about the fundraiser.
You want to talk about fundraiser? Amy's not in here, so we have to talk right, because she'll probably listen to
We
this.
have a director of fundraising, and she is so good at what she does. So it's called Cheeseburger in Paradise, and it is Jimmy Buffett themed, and tickets are still available on our website. And
Well, hold on. When is the actual event?
February 22nd.
And what's today? Today is February 8th?
Yes.
8th. Ashley says the 8th.
Yes.
So, okay. So, yes, talk about it, because
Okay.
this will come out before
Oh, great.
the event.
Yeah.
So, let's keep going.
So it's God, here I am just kind of extemporaneously speaking.
We wanted a signature event, and we wanted to get out there to the community that we were here. We've always had a bigger event, but we wanted something that was signature and something for the community, not only as a fundraiser, but also, letting people know that we're out there. So we started MHA Rocks, and we have a different theme every year.
Okay.
We've had British Invasion. We've had Dancing Through the Decades. Last year we had to cancel it because of COVID. They just wouldn't even let us schedule where we were scheduling. So, music is really good for the soul, and people really enjoy having it. So our fund development person is like total Jimmy Buffett right now. And everything is Jimmy Buffett. So it's going to be fun. We all dress up. We just have fun. A lot of different
Games like
and
pick a wine bottle, and
photo
everything
booth
benefits
and-
MHA.
Yeah. So right now, and I don't know if it's in the screenshot, but we have a wonderful little tabletop turtle.
It is
next
not.
to
We will get
Neptune.
Andy, heads up. We'll get B-roll of that. Throw it
Yeah.
in.
Okay.
And I have another turtle that is probably being painted at this moment. He will only give me little clips. At Vero Beach High School, they are doing a small tabletop turtle that we're going to put up for auction as well. And then we have a centennial turtle that's going to be up there. And going back 2 years with the rebranding, we brought back the turtles. People didn't know the turtle tracks in 2006 and all these turtles in the community was for mental health awareness. And
They just see a turtle and they think,
Beachy.
yeah.
And
We need to save the eggs.
Yeah,
the
right.
turtle eggs.
And we did make a lot of money on it in order to start this walk-in and counseling center and continue this legacy of having free and no barrier help. So our MHA Rocks is one of our biggest fundraisers. We have a lot of great sponsorships this year, and we just make it the funnest party. And
It is open to the public.
Yes.
To
Open
buy
to the public.
tickets. Yes.
Say the date again.
February 22nd. I keep saying, February 19th.
it's the 19th.
2022.
February
Yeah.
19th. That's a Saturday.
Yeah.
Well,
Okay.
only because on Amy's, our fund development person's board, she says 11 days left from MHA Rocks. And I'm like, 11 and
It's too many
8.
numbers.
All
Yeah.
So,
right. So February the 19th.
yes.
Right.
It's open to the public. How much are tickets?
It's $90. And then there's a VIP. And I don't know, but but you
All
can
right,
go
90
in.
bucks. You can
Right.
get in for 90
Yeah.
bucks.
Yeah.
And where is it?
It's at Oak Harbor.
Okay, that's
Clubhouse,
Indian River Boulevard,
Indian River,
north
yes.
by Grand Harbor.
Yes.
Mhm.
Okay, and how would somebody get tickets to that?
So you can go on our website and you can go through there and purchase a ticket, or you can call our office and we will put you in touch with Amy, who can get your information and get you a ticket.
And so is this the biggest fundraiser that you guys do every year?
This is our biggest fundraiser. We do have a birthday party every year because when we turned 60, we decided we wanted to do a birthday party. So now we're traditionally kind of doing it every year at Big Shots, but it's a very small event. So this is our big event. We really count on this event.
This was a very timely podcast for
Yeah, but we're also going to be at the air show, right?
We're going to
in
be
March.
doing, I wanted the merchandise booth. So we're going to be at the air show. I was just at a veterans picnic because we do a lot for veterans. We have a free veterans meetup at our drop-in center. I didn't really talk much about our peer services, but staying still on the peer advocacy, we run 3 drop-in centers, one in Indian River, one in Okeechobee, and one in Martin County. That is all peer run, and it's open 7 days a week, and people can go, and it's all peer services. They do different events. They do different types of groups. It's not in any way structured. It's more like you go to the Italian American Club and
Yeah.
you become a member. That's
Mhm.
what they are. And they have that sense of community and support that they might not otherwise have in the community. So, we really focus on, veterans and first responders. There's a huge need. And
again, that's one of those
Yeah,
niches.
that's a niche.
Yep.
Yes.
So, we try to do a lot, we're having an Operation New Day for Wounded Waters, which is a wonderful nonprofit. We work with Dogs for Life.
Oh, you would love Wounded Waters.
Yeah,
Yeah.
I'll tell you about them, but we have an
Yeah.
Operation New Day and I'm trying to fundraise. So not even just our nonprofit, but looking at it as a community because we are a community and we have to look out for one another.
Yeah. Yeah. It's funny. There's a lot of money in this community. And normally you would get these nonprofits. That would butt heads because, I need those dollars. I can't let them get those dollars. But what I've learned probably in the last 2 or 3 years is these nonprofits are doing what you're doing. And the saying I've always said is collaboration is the new competition. So it's like, you don't need to compete for these dollars. You need to get the dollars. And then, you can figure out how you can use them either together or however those funds need to go. But if you keep competing for these dollars, nobody's going to get them.
Absolutely. And there are several nonprofits in the community and new ones all the time. And they all have great missions and visions and they look at sustainability, but there's enough money in different pots. And I would just kind of want to give you an example. We had a gentleman that came in for a screening and was COVID kind of thrust him, into a substance abuse issue. Wanted help, kind of begged us. And we're like, okay, we're not a substance abuse facility. And my CEO at that time says, okay, well, let's send him to your friend. And we got him into Phoenix Rising and he did really well. And then we ended up getting a bill for $60,000. So,
Wow.
So we were just like, and the guy was doing great, but I go to him and I'm like, okay, do you have any funding for indigent patients? I mean, we do. We have hospital taxing district funding. We have appropriations. We have a no barriers. And they're like, well, we didn't even know we can try to get it because we're a for-profit. Well, now they're receiving hospital taxing district dollars with our assistance on introducing them and helping them with grants that they can actually provide it to those people coming in here that need that intensive outpatient or that substance abuse. So again, working together as a community and trying to solve problems together. It benefited them, absolutely, but it also benefited us because this person is in the right place.
Yeah. No, that's a great example of instead of putting your blinders on and just staying in your lane and saying, well, I'm not going to talk to those people and I'm not going to worry about those people. You actually work together. And like you said, you got the dollars that were available, but even though you didn't actually get them, they're benefiting you. I think it's a wonderful story. It's great. That's really all I had for questions. But I always give the guests an opportunity. If you've got other stuff you want to speak about, if you've got statistics, if you've got other programs that we didn't bring up, Go for it.
Yes.
There is one thing I want to say on the marketing end, though.
Oh, I definitely want to hear this.
What we are looking for is testimonials. We are looking for shareable content. Think of Upworthy. Think of Humans of New York. Think of things that really people say.
Humans of New York is one of the coolest
Isn't it?
things
It's-
I've ever seen.
It is one of the best.
It's literally stories from people that live in New York, and they're just
Right.
interesting stories.
Right.
And the latest one I heard was about this guy that was like a piano. What's the word I'm looking for? He was very young and was phenomenal at piano. And so anyway, he ended up, to make a long story short, he ended up being like the head guy at like one of the biggest symphonies in the world. But it was just all about how he walked into NYU and was like, hey, can I just try out? Like, I don't have any money, I don't have anything. And they were like, well, all right, there's a piano over there, go for it. And he was just going nuts, and a prodigy. That's the word I'm thinking of. And they were like, yeah, you need to come to school here. And like, that's one of a million stories that they have on
and
that
because they talk about it, that's shareable content, right?
Cool.
Yeah. So it's inspiring other people to say, hey, I see myself in this story. So likewise, if we were to have, if you're listening to this, whether it's on video or on the podcast, and you do have a story about MHA, if you're a success story, we're looking for that shareable content. We're looking for people to maybe send it to us or email it to us, whatever we can, because I think it's important also to talk about this stuff.
Can they possibly reach out to you to get content of them?
Yes.
Okay.
We have forms too.
Well, and you can just go through the internet and you can hit the contact, and it actually comes to all of us,
Right.
and one of us will respond.
Okay.
Because people ask questions all the time, and we do have some wonderful stories coming through here. I get to hear them because I work closely with my staff in the front. But it's people sharing their experiences and just sometimes little things. We had somebody come in for a screening, just had no motivation. And then the next week brought us a gift and said, I felt like I could do my crafts again. And it was absolutely beautiful, the gift she gave us. And she goes, it just inspired me because now I have the hope.
So that does lead me to another question. Again, from a marketing perspective, I'm all about the numbers and inside the box and all that stuff. So we have key performance indicators. We can tell what's a success. We can tell what's not. How do you tell what's a success story? Are there indicators? Like maybe that's a success. Hey, I've got motivation to do crafts again.
So when somebody comes in, we do ask them some serious questions about any self-harm or thoughts. Well, we do a lot of safety plan, violence risk assessments, and we do 48 hours after the screening, we contact them. And some of those success rates as far as safety planning and suicide risk assessments, we just kind of know that they could have led to a Baker Act. And it's traumatizing for somebody to have to go through the hospital and the police escort. Of course, you have to do a Baker Act if somebody meets criteria, but most of the time you can interact with that person. We also use scales on people. It's a generalized anxiety scale and pediatric symptom checklists and different scales to monitor somebody throughout their progress and their goals. So we've had a lot of people be able to go back to work that couldn't work. And it's wonderful. They actually get off our funding and we're like, oh no, we're not going to get paid, but we're going to continue working with you. But there's great stories. There's great stories about kids and families being able to be a family again. Of course, there's always a lot of work out there. I think we tend to look more on the side of going, what else can we do? But also try to stay in our wheelhouse of what we do well. Trying to get those kids the education and support about mental health, even going into the schools and teaching them the Erica's Lighthouse model. The kids are going home to their parents and telling their parents. I hear it from their parents. Oh yeah, my kid told me, don't worry, if I get depressed or whatever, I know where to go. We also do skill building because it's really important now with kids these days to be able to learn how to control their emotions, how to focus. So we're in all 3 boys and girls clubs in this community to provide what we call it's a smart but scattered program, but it's just to provide those basic skills that we sometimes don't think that the kids, are getting in different ways, doing different exercises with them. And so always trying to kind of look at those things and just to kind of throw out some statistics, and somebody can look at the State of Mental Health in America report. It just came out. It's 2022, but Florida ranked 49th in access to mental health care.
Out of 50.
Yes.
That's not good.
Yeah,
No, that's
and
I'm not a mathematician.
Yeah. And if you go in there and look at this report, you have to sign up for Mental Health America, but it's absolutely wonderful, the stuff you get from them. But also 5th in the prevalence of youth with a major depressive episode in the past year. And these are all current stats from the past year. And 6th in adults with serious suicide thoughts.
So 49th out of 50, which is bad. It's like second, 5th and 6th. Yeah, that's a problem. That's a problem in the state of Florida.
Right, it is.
And we try to look at that because, again, in the advocacy, and we ranked 42nd in mental health workforce availability. So is there enough people to be able to provide that?
And that was my question to you about staffing, is if you've got a lot of people that come in, can you help them? It sounds like you guys can, but maybe some of these other clinics and some of these other places that, provide mental health assistance.
Yeah, we can't take everybody that comes in for a screening. Like I said, it may not be appropriate for them, or somebody may just come in for a screening and go, you know what, I'm not ready for therapy. Right. Okay, well, we're here if you need us. You can come back in next week. You can come back in next month. Also, we want to be able to have people have accessibility to other services. So we do a mood and anxiety support group the first and third Wednesday of the month at noon. And it's a hybrid group, so they can come in, they can call on the phone, they just have to call up front and register. They don't have to have had any services from us. Just people with anxiety and depression feel alone, and this helps them be able to share their stories if they want to share.
Yeah, even if it's just situational, even if we want to talk about that too. Last week, 2 people plus the counselor showed up, and she said it was wonderful. They were just talking with each other. And that alone is important to know that, listen, I'm just having a really anxious week, and it could be situational, but you don't know that unless it's peer-to-peer. And so a success story, I'm going to tell you what my personal therapist said. A success story is when I know you're doing okay and you don't need me. And so that's what they said was an actual success story. Yeah.
There's your indicator.
Right.
Yeah.
Right. So as from a marketing aspect, because we want to respect the fact that this is a marketing podcast, we really want to have people understand that as far as the marketing goes, I could sit here and blast social media with ads and come see us, but ultimately, we want people to know that there's going to be someone in this facility who's been through what you've been through, and we want you to be a success story.
And we do track our referrals, and from a marketing standpoint, we look at that every month in our marketing. And our biggest referral source is family and friends.
Word of mouth will always, whether you're the Mental Health Association or you're Jordan Mowers selling lawnmowers, or you're Elizabeth Kennedy Catering and you're selling lunches or catered dinners. Word of mouth will always be your number one referral source.
Yeah.
But what is word of mouth in 2022? Social media.
Yes, absolutely.
It is.
How people communicate.
It is.
So,
yes.
Yeah.
So
now I'm going to start watching podcasts more.
I love podcasts. Just, it's
and
the
really,
radio.
Wendy is just so needed here because we needed to look at a different avenue. We rebranded and we did amazing with that. Great annual reports and material, and just getting out there on the social media, the podcasts, the TikTok. I have TikTok now. Because
did you know that TikTok was the number one most visited website in the entire world in 2021? More than Google, more than YouTube, more than Facebook, more than all of that. TikTok.com, technically.
Wow, I believe it.
Number one most visited website in the world.
Well, I went to get my TikTok account so I could open these TikToks people keep sending me from the office, because we kind of share jokes. You got to laugh because And I open it, and lo and behold, there's my 2 daughters that have TikTok that tell me they don't have TikTok.
Oh boy.
I created my TikTok in 2020, 2021. And I think one of the biggest reasons why is TikTok became a community for people that were on lockdown, and people got creative. And you know, what makes us creative, especially in marketing? Desperation gives birth to innovation. And I think that is so important. And that's why TikTok skyrocketed the way that it did.
I'll tell you this, TikTok's algorithm for putting stuff in front of you that you want to see is far beyond anything I've ever seen.
Massive.
Amazing.
And that's what keeps you on there
Right.
for so long. So the reason I bring that up is if you're going to have a TikTok channel and you're going to be producing content, the people that need to see you will probably start seeing you. But they will not see you if you do not have that channel.
Right. So if they're watching mental health, it's going to come up on their FYP. It's going to come up on their For You page. And right now I have our first 5 posts up and they're doing really well. But the issue is right now I cannot be the face of TikTok because I'm not a clinician. Right. But our CEO, who also has his PhD in psychology, he said, you know, why don't you just, he said, herding the counselors together is like herding cats. Because as Angela explained, they're extremely busy with clients. So I decided to put beautiful footage, HD, to quotes that come from our clinicians. And I started a Whispers campaign, quotes that clients would ordinarily give, such as, sometimes I feel like I should be further enough along for my age, or sometimes I feel like my friends don't understand me. And when we post things like that, it's thinking someone else thinks like I do. So that's where we're taking the TikTok for right now.
It's a great strategy.
Oh,
I
thanks.
highly recommend it, especially if you're trying to hit the youth. I know you're trying to hit everybody. But
right.
You know, if you're trying to hit the youth, that's definitely the platform.
Thanks.
To go to.
Well, I appreciate your perspective from a marketing aspect.
You're welcome.
So,
all right.
I trusted you with the TikTok. Now I absolutely love it. I'm going to have to show it. Did I send you some? Oh my gosh.
Yeah, send them to me. Thank you. There's a couple I'm trying
wonderful.
Good. Anything else?
Oh, I could talk all day and have so many things, but I think we covered the basis of it, and I'm so happy to be part of this. And like I said, we are always there for people. And what I like most about working at the Mental Health Association, not because I'm COO and make all the decisions, but because we are out of the box. So nothing is red taped. And if we want to do something, she wants to do TikTok, I'm like, okay. Now I'm accepting of TikTok.
That's what I like about podcasts. We can go as long as we want.
Yeah.
We can talk about whatever we want.
Right.
We can cuss.
Right.
We can say whatever we want to do.
There's a certain finesse and an intuitive empath like you have before. You have to know what they're actually doing, though. You know, it takes an intuition to know what's going on, what's not working.
Right. Right. Well, you guys got us gifts. We got gifts for you guys too.
Oh my gosh.
That's our
that
color.
is my favorite color, and
that's
our color.
Awesome. Well, there you go.
Thank you.
I'm going to say this is 10 times better than the mug we gave you.
Yeah, it is.
And
I
you
drink a lot of coffee, so it wouldn't always get in handy. But
this is probably what I drink in a day of coffee.
Wow. Yeah.
Well, I want to thank you guys very much for coming on the podcast. Again, thank you for hosting it.
Yeah.
Again, it's kind of out of the ordinary for us to actually be in the place where we're interviewing the folks. But
thank you for being adaptable with the bad weather today.
Yeah,
I really
appreciate
appreciate
this outside somewhere else. Not a big deal.
Yeah.
But I do want everybody to understand that, you know, this is a phenomenal resource in this county, and I personally think it's underutilized. I think the more people hear about it, the more people know what it is. Fortunately or unfortunately, I think you guys will get busier, and I think ultimately it's a great thing. So again, I want to thank you guys for reaching out to be on the podcast, and thank you for being here.
Thank you for having us.
Thank you.
All right, that's gonna do it.